When someone has pain in the right upper stomach area, it's usually because of the gallbladder. Yes, other causes exist, like liver disease, muscle pain, or stomach ulcers. But in most cases, we suspect gallbladder problems. When we say gallbladder problems, we usually mean two main things. First, gallstones that irritate or block the gallbladder duct. Second, a gallbladder that contracts weakly, not fully emptying. Remaining bile irritates the gallbladder, causing pain. In this video, I'll explain signs, symptoms, how to diagnose, and how to treat gallbladder issues. Gallbladder pain typically starts after eating fatty meals. It's usually dull, steady, or cramping, not sharp or stabbing. It can last anywhere from 30 minutes to several hours, often radiating to the right shoulder or upper back. 80% of people experience fullness, bloating, nausea, or vomiting. Changing positions, antacids, or bowel movements usually won't relieve the pain. Here's a specific way to check. Ask the person to lie down and take a deep breath while pressing under the right rib cage. If they suddenly stop breathing and wince, it's called Murphy's sign, a strong indicator of acute gallbladder inflammation known as acute cholecystitis. Even without inflammation, pressing the gallbladder area may still cause discomfort. Sometimes even a healthy gallbladder can feel discomfort after heavy, fatty meals. Increased bile flow stretches the gallbladder, causing mild discomfort. For diagnosis, ultrasound, CT, or MRI are helpful, but ultrasound is preferred. Ultrasound effectively detects gallstones. However, finding gallstones doesn't always mean pain. Only 30% with gallstones develop symptoms. If ultrasound shows a thick gallbladder wall, it signals inflammation. Without symptoms like pain or fever, treatment usually isn't necessary. Sometimes ultrasound shows sand, biliary sludge, tiny crystals of cholesterol or pigment. While not true gallstones, sludge can cause similar symptoms or progress to stones. Biliary colic is sudden, severe pain in the right upper abdomen after fatty meals, sometimes spreading to the back or shoulder, caused by temporary gallstone blockage. We've all heard gallstones often lead to surgery, but not everyone with gallstones needs surgery. If there are no symptoms, surgery isn't required. Even if symptoms occur occasionally, immediate surgery isn't always necessary. Only about 30% with symptoms eventually need surgery. Surgery, cholecystectomy, is recommended if repeated or severe gallbladder attacks interfere with daily life. Acute cholecystitis develops. Murphy's sign is positive or gallbladder wall thickness increases. A gallstone becomes lodged in the duct. The usual treatment is laparoscopic cholecystectomy, removing the gallbladder surgically. Fortunately, around 80% of people with gallstones never develop problems and don't need treatment. Another treatment is oral bile acid therapy, ursodeoxycholic acid, but it's effective in only about 40% of cases, and stones often return after stopping. NSAIDs like diclofenac are most effective for gallbladder pain, helping over 60%. Milder cases usually improve with dietary changes. A low-fat diet is crucial. Choose unsaturated fats, olive oil, nuts, avocados, over saturated fats, butter, fatty meats. Eat smaller, frequent meals every 3 to 4 hours. Avoid fried foods, fatty meats, dairy, cheese, butter, cream, rich desserts, fast food, and processed snacks. Instead, bake, grill, or steam foods. Choose skim milk, lean meats like chicken or fish. Increase fruits, vegetables, whole grains. A low-fat diet reduces symptoms for 40 to 60% of people with mild pain. Medications that relax digestive tract muscles might help reduce gallbladder spasms and cramps. These include hyoscine, buscopan, drotaverine, Nospar, dicyclomine, and papaverine. Their effectiveness is moderate, helping about 20–40%. Nospar is most effective among these. After gallbladder removal, cholecystectomy, in the first 1 to 2 weeks, start with clear liquids, water, broth, gradually adding low-fat foods, toast, rice, bananas. Avoid greasy, fried, or spicy foods early on. Later, most people return to a normal balanced diet. Continue smaller meals and limit high-fat foods to avoid loose stools in about 10-20%, especially early after surgery. Lean proteins, chicken, fish, whole grains, fruits, vegetables, and moderate healthy fats, olive oil, avocado are recommended. Monitor how your body reacts. Drink plenty of water. Usually, no regular medication is needed after a gallbladder removal. Rarely, bile acid binders, cholestyramine, might be used if watery stools persist. Digestive enzyme supplements like pancreatin, creon, are rarely necessary unless other issues like pancreatic insufficiency exist. Generally, gallbladder removal slightly increases the risk of high cholesterol and fatty liver disease, but routine statin use isn't recommended unless there's another specific reason. This surgery rarely causes significant long-term issues. In the end, understanding your gallbladder helps you manage pain, eat wisely, and live comfortably. Because knowledge is the first step toward health, freedom, and a better life.